I've been fishing since I got out of diapers.
Once Willis Richmond wades into the water, you'll be hard-pressed to get him back to shore.
I don't stop. I keep on going until either the light runs out or the siren blows or my buddy gets too tired.
It's a far cry from last summer when this fly fisherman suffered from intense joint pain. His scans showed the problem: slightly bowed legs and a loss of cartilage in both knees.
The joint space is pretty much gone on that inner side of the knee. So that's a patient who has moderate to severe arthritis.
Dr. James Keeney is an orthopedic surgeon at University of Missouri Healthcare, specializing in adult hip and knee reconstruction. He recommended a bilateral knee replacement, one surgery to fix both knees at the same time. He says for those who qualify, it can save money and help with the recovery process.
It allows people to get back on their feet, I think, a little bit quicker than if they had staged that and gone through 2 procedures.
Dr. Keeney removed all the diseased joint surfaces, replacing them with metal and plastic implants. He says the number of knee replacements performed each year is expected to climb over the next decade to between 2 and 3 million. Meanwhile, recovery times are decreasing.
We have most of our patients now who are clearing physical therapy in less than 23 hours of their admission, and they're ready to go home and continue the recovery, which is a significant change from where we were just 3 to 5 years ago.
For Willis, the surgery has been life-changing.
I just can't say what it's done to give me back a part of my life that was missing, and it's pain-free now too.
Back to fishing for as long as he likes. From the University of Missouri, I'm Teresa Snow.